can still see my cursor?
Yes.
Thank you. Okay, so you can see this. Here's where we are, week 10. And it ends.
I'm not seeing anything, Charlie. I don't see a screen shared. I don't know if everyone else in the class can.
I don't see anything either.
Okay, well, somebody said yes, so I went on. So
I thought you asked if we can see you. I'm sorry, that was my fault.
that's okay. Okay, how do we gonna do this? First, let me just try a quick refresh. That didn't help, did it? I'm moving the cursor right at the top.
No.
Okay. Okay, we'll do it back. You're not seeing St. Charles Bridge, are you?
I see a bridge.
Huh?
I see a bridge.
Okay, you see a snowy bridge? Then we're screen sharing. So do you see the cursor now at week 9?
Yeah, I see it.
Anybody else?
Yep.
Yep.
Okay, so we got it solved. Okay. I've got quite a few pieces of information for you here. And all of this is referring to P3. What about L2? That's most immediate on your mind. But you've had all of L2 material already. For L2, in fact, under preparing for L2, I copied the email I sent to you, and here's the material that you need to do for L2, all of which we have already covered. So it's up to you if you need to ask any questions about that to do so, or to email me. Okay. Hopefully you saw some of that during the spring break. Okay, so I'm on 330 today, and this is fetal circulation and the vertebra model. Okay. I didn't catch this date change. It needs to be done, but date changes are never important. Fetal circulation obviously is circulation before birth. And circulation before birth, and then we contrast it with circulation after birth. On the left-hand side, this is the circulatory system of the fetus. On the right-hand side is the circulatory system of the newborn. The circulatory system of the newborn is going to last it its entire life. So this is also the circulatory system on the right of the adult. Okay, so before birth and then after birth. Well, the place where gases exchange, those gases being CO2 and oxygen primarily, and where nutrients exchange are going to be in the placenta. Here's the placenta. Oxygenated blood comes from the mother and enters into the red vessels you see here, and one large red vessel that goes up and through the belly button, or the umbilicus, as we call it. This is the umbilical or umbilical vein. The red one is actually a vein. It's carrying oxygenated blood. We said that that can happen. Veins travel towards the heart, so it meets the criterion of a vein. It brings oxygenated or oxygen-rich and nutrient-rich blood up through the liver. But rather than going through the liver, as it would in the hepatic portal system, the blood is bypassing the liver for the most part. Some blood has to stop off at the liver because the liver has to have oxygenated blood too. But we have a shunt, as it's called. A shunt is a shortcut. This shunt is right here, if you can follow the line. Maybe I get the line a little bit bigger. And this is the ductus venosus. The ductus venosus is the shortcut through the liver. Of the umbilical vein. Okay, so here goes the blood. And where does it come in? It empties into the inferior vena cava, which then goes into the right atrium of the heart. I don't like the coloring pattern that they've used. It's too much pink, too much dark blue. When you have this red coming in, oxygenated blood from the venous ductus venosus, and it enters in and mixes with the vena cava blood, I wouldn't expect it to stay blue. I would expect it to blend a little bit in color, but they didn't do that.
The vena cava is purple.
Oh, okay. Well, you know that's a problem of mine. I'm never going to get purple right.
Right. It's purple right there and then up on the greater artery or aorta area.
Okay. Okay, well, anyway, the blood does come from the ductus venosus into the vena cava, and from there it enters into the right atrium. Also coming from above, from the superior vena cava, the blood enters the right atrium. The blood from above is not coming from directly the placenta. It's making a circulation or circuit through the upper part of the body and then being retrieved. So the blood does enter here. It's a mixture of very highly oxygenated blood, vena cava blood from below and vena cava blood from above, which is partially spent. This has now got to move out of this chamber. One way, the typical way, is for it to move through the tricuspid valve and into the right ventricle. And what we're trying to do here is bypass the lungs, get the blood back to the placenta where it is oxygenated. In the right ventricle, the blood comes up, is pushed out through the pulmonary trunk. We're familiar with that. But instead of just going left or right to the pulmonary artery here, or the pulmonary artery over here, most of it goes straight forward and joins with the end of the aortic arch. Here's the arch. This is called the ductus arteriosus. This shunt or pathway or shortcut is the ductus arteriosus. We had ductus venosus down here. And now here we have ductus arteriosus. The blood entering into the aortic arch is not going to be going upward. It's being forced downward all the way down, getting to the organs of the abdominal region, the stomach, the adrenal gland, the kidneys. And then it enters into the pelvic region. And there are two vessels. Here and here that come around. These are the umbilical arteries. The other umbilical artery is coming through here. And this blood is partially spent already. It's not exhausted, if I can use that term. The two umbilical arteries join and they make a sort of candy stripe around the umbilical vein, which is going in the opposite direction. The umbilical arteries and the umbilical vein make up the umbilical cord, where the pointer is right now. And the arteries then come down in their semi-deoxygenated state, pick up oxygen from the mother and at the placenta and return by way of the umbilical vein. That's one pathway. We have a second opportunity. Coming in from the ductus venosus through the liver to the vena cava, the blood from the placenta goes to the right atrium. But instead of now going downward to the right ventricle, there is a hole between the joints, the right atrium and the left atrium. There's a hole in the heart. Okay. The blood can then go from one atrium directly to the other. And this is that oxygenated blood or semi-oxygenated blood. You go to the other side, come down to the ventricle on the left side, go up through the aortic semilunar valve and enter into the aorta. So here we have oxygenated blood, and it's got a chance to go to 1, 2, 3 vessels. The first being the brachiocephalic, then the carotid, and then the subclavian on the left side. These will take the blood to the brachiocephalic region. That's the arm and the head region, going up. When this blood comes back, it comes back to the vena cava. The hole between the fetal atria does not show well in this drawing. It's called the foramen ovale. Trying to find here's where the sticker is. Foramen ovale. We've had that word before. At birth, the foramen ovale must close. It should close immediately. And when it closes, then this direction is cut off, going from the right to the left side. It's establishing the adult circulation. At birth, the ligamentum arteriosus is formed. The ligamentum arteriosus is the decay product of the ductus arteriosus. So here's the ductus arteriosus. It right up here, it collapses. And now the blood loses that shortcut. And the ductus venosus down here collapses and becomes the ligamentum venosum, which is essentially a shriveled up piece of scar tissue. The umbilical artery and vein are lost. The umbilical cord is lost. So at birth, there are 4 things that happen. Start where we left off. The umbilical cord is lost. The ductus venosus shrivels up, becoming the ligamentum venosum. The ductus arteriosus shrivels up, becoming the ligamentum arteriosum. And the foramen ovale, the hole, closes, and it's called the fossa ovalis. 4 things happen, and only one of those 4 occurs in the heart. That's the closure of the foramen ovale to become the fossa ovalis. If all of those things come off correctly, then this is what you're left with. And the newborn circulation pattern persists throughout life. If the foramen ovale does not close or closes only partially, you may end up with what's I can't say the word, colloquially called a blue baby. Okay, because a lot of oxygenated blood is being diverted in the wrong direction. If the blue condition continues, in other words, it does not close up, then it may be necessary to do heart surgery to close it up. You and I may have incomplete closure of our own foramen ovale, and our fossa ovalis that forms the scar tissue may, maybe not, have a small little hole in it. That's not enough to matter. That's not enough to matter. It probably means you won't be getting a gold medal at the Olympics in the 100-yard dash or anything like that, just because of that. But a small imperfection is tolerable. The thing I like about my edition, and I have edition 7, and I know this is not the case in all of the editions. Okay. I like the way they put a rectangle around the 2 events that coincide. This becomes this, this becomes this, this becomes this, and this becomes this. The umbilical vein, I didn't tell you about ligamentum teres, I won't. I'd rather go with the fact that the umbilical cord is lost, both parts. If you like the rectangular presentation that they have here, and you don't have it because your edition doesn't, you might want to use colored markings, colored marker pens, and color yellow and yellow, no matter where they are, and light blue and light blue, just as a suggestion. Any questions?
What happens if there are any issues with things like the ductus venosus shriveling up?
Yes, there are. Sometimes it doesn't show up right away, but as soon as the umbilical cord releases or is taken off, there's no more blood going to it. So it will become scar tissue.
Okay.
Below the page in the diagram I have some text outlining the changes at birth for you. The vertebra model we're going to do next. It's on the same page. Reading this to you, this may seem out of place, the vertebra model, but it's good to get it behind us before we start on the nervous system. It only consists of one model, and you only need to learn the structures that are here. Functions will come later. I'm going to pass by the text first and show you the model. We actually did not do the model until about 10 years ago when one of the physiology instructors threw it in on a test and it survived. So here it is. Okay. We all know the vertebra. Okay. So this must be the spinous process at this end. The spinous process here is split. That's said to be bifid, B-I-F-I-D. And since the spinous process is bifid, in this case, this must be a cervical vertebra. Okay. Lumbar, sacral, coccygeal, and thoracic vertebra are not split like this. And actually, not every single one of the cervical vertebrae is split, but when they are split, it's always cervical. Here's the spinal cord. Inside that vertebral foramen that we stuck our, I had you imagine putting your little finger through. Okay. Over here, way over here, sensory input is coming in from the nervous system. It's coming in. It's going to go to the posterior side of the spinal cord. This is the posterior side. When it does come in, there'll be a bulge. This sensory information here is like pain, heat, pressure, cold, tickling, anything that affects the skin. The type of neuron that brings this impulse in has a peculiarity that we'll talk about later, but that peculiarity causes this swelling. And this swelling is the dorsal root ganglion. You can always tell what this is because of the swelling. And the material is, the impulses are going inward. And this portion here, which is thinner at the end of the arrow, is the dorsal root. The dorsal root is what we call afferent. Afferent, you've had the word before in the kidney. Afferent means incoming, loving. And here it goes, the dorsal root, to this spot right here. This is the area here of gray matter called the dorsal horn. This is part of the gray matter called the ventral horn. This entire set of moose antlers is the gray matter. The other portion around it here, 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 and here is white matter. We'll have the difference on the next actual lecture, to be a week from today, of what gray matter and white matter are. Okay. We're right now just getting the names of these structures. Dorsal root is here. The dorsal root is here, I should say. Dorsal horn is here. Ventral horn is here. This arrow points to more gray matter, and this to more white matter. When information comes from the brain or in a reflex arc, which let me get away with saying some things you may not know yet, because I'm not going to skip over anything eventually. When the information leaves the spinal cord, it goes out this way. And this is the ventral root. And it will run parallel to the larger dorsal root. Dorsal root, and the swollen part being the dorsal root ganglion, and the ventral root going the other way. It's an efferent. I use the terms afferent and efferent, but for the dorsal root, I could also use the term sensory. And for the ventral root, I can use the word motor. This senses, gets to the gray matter. It can now go up to the brain. The brain can decide what to do about it. The brain can decide to ignore it, to do nothing. Or it can decide to do something, send the information back down in a motor impulse. Out that motor impulse goes through the ventral root. Now, same picture, so we've only added a couple of things, actually only one thing, the dura mater. The spinal cord is coated with tough material, tough connective material to protect it. And is this pink?
It's gray.
Gray?
Yeah.
Okay. Okay, this gray area here that covers the dorsal root ganglion and the ventral root, but it also spreads out over the spinal cord. This is the dura mater. Dura mater translates into tough mother. Okay, and that's one of the three coatings and the most important one around the spinal cord. I'm flipping this on its side. You can see this spot here, becoming this spot here. Coming off of the spinal nerve, which is not labeled, we have this little transition going to this spot. There's another one over here. These like nodules. These are the sympathetic trunk ganglia. Sympathetic referring to the sympathetic nervous system, which I've asked you to read, but you haven't done it yet. So just hang in there. Sympathetic nervous system, trunk ganglion. Okay. Every vertebra has a sympathetic trunk ganglia on each side. And then there's another, and there's another. And they're interconnected so that the impulse that these guys conduct can go throughout the body quickly. Here's a nice picture of the ventral root. and a little bit better of the dorsal root. Okay. Okay, I'm going to go through these two in a moment with you, and we'll get started on vessels. The vessels are going to be part of P3, which is not that far away. It's on the 15th. Well, on the 1st, this Thursday, you have L2. And, you know, on the day of the exam, I don't have you do anything else. Okay. So you'll actually have 2 weeks to learn these vessels. I want to at least show you one presentation of these vessels today so that you can get started on it immediately. And I'll post everything else Thursday night or Friday morning that you need for that 2-week period that's coming. Okay. I showed you this link, preparing for L2, the email. If I haven't, here it is. Here are the list of terms that L2 can incorporate. You should know roughly how to use all of these terms. It always seems like a lot until you take it apart, and those are the terms. The practice quiz for the first practice quiz for L2 is here. The second one is here. Okay, and I'm not going to open them up here. That's for you to do. Okay, and then the second lecture exam L2 you won't see on your screen, but it's located right here. Can't be opened anyway, so until 2 o'clock on Thursday. You can start as late as 2:30, just in case you get behind in traffic or something like that. Okay, so what I want to do is do these two in just a moment. Okay, and we'll give us a break for 10 minutes till 3:20. Okay. It's 3:10, 3:20. We'll see you. Okay, we're back.
Hi, Charlie.
Howdy. Okay, before I go back to sharing the screen thing, any questions? Okay. Okay, can you see me up at week 10, the cursor?
Yeah, I see it.
Okay, and it's moving. Okay, great. Okay, uh, vessels. Well, we talked about blood. We talked about vessels and types, uh, but we haven't named them. We're going to look at vessels above the diaphragm first, using a cat today. We'll use human models another day, and then below the diaphragm. These are pages you may want to download for yourself. So you can do that right here, as you know. Okay. Okay, these vessels above the diagram, I've identified the ones that are important in bold letters after the diagram itself. Those are the ones that could be asked of you. Okay. First, we'll do the veins. Why the veins? Well, when you're actually looking at a specimen, cat or anything, the veins are more outstanding. They're dark blue, and they inject with a latex much better. Sometimes the arteries are okay too, but usually the arteries are a little bit more difficult. So here's a diaphragm, and I do have photos coming up. Okay, here's the diaphragm down here, and we'll just take the easy way, the easy ones first, on a cat. Okay. Now you don't have to give the function of these. All you have to do is name them. So that's pretty nice. Below the heart, returning to the heart, is the inferior vena cava. Leaving or above the heart, this large vessel here is the superior vena cava. Now, we all know intellectually that these veins come towards the heart, but it's like following a road map. You take the biggest street first, and the littlest one, and the smaller one until you get to your destination. We always work away from the heart, just easier. Okay, here's the superior vena cava up here. About halfway up the superior vena cava is a vessel coming in called the mammary. It comes from both chest walls. Well, how can one come from both? Because you have a mammary over here and a mammary over here, and they come together as a Y, and just the leg of the Y comes in. This is the mammary vein. Now, some books have other names for it. Internal thoracic vein, all more difficult and not as descriptive as mammary vein, which we want. Okay. I'm going to skip the vertebral for now. Okay. Right as you leave the heart, on the cat's right side is a vein that comes from the body wall, comes from the rib area, and comes up. It's kind of a spectacular vein and rather eerie looking. Uh, much more so than this diagram. It's the azygous vein. I'll show you one. Azygous feeds into the superior vena cava. Mammary feeds into the superior vena cava. Moving away from the heart, the superior vena cava is formed by these two structures, sort of a Y that again you see here. This is the brachiocephalic vein because it's going to service the arm, the brachial portion, and the cephalic or head portion. We'll go off to the other side first. This is a brachiocephalic vein. Now it splits. Part of it's going to go up the neck, and part of it's going to go up the arm. We'll take the neck portion first. From where my cursor is now to where it ends up, here is the external jugular vein. It's drawn nice and straight here, but in reality, you find it in the cat, and it's quite often got a curve or two in it. External jugular vein. Coming up the external jugular, there's a vessel that comes off and goes over the shoulder blade. This is the transverse scapular vein. Come up till you reach this four-way intersection. If we go laterally, this is the maxillary vein. Goes along the side of the head and the nose. If you go forward, this is the lingual facial vein coming from the tongue and the face. Going across is the transverse jugular. Going up the other side, since this is going to be symmetrical, which is nice, here is the lingual facial, and here is the maxillary. This is the external jugular again. Here's the transverse scapular again. Going inner or inward, this vessel here and this vessel here are the internal jugulars. I have some pictures in just a moment that show this well. But actually, in most dissections, you do not get to see it very well at all. Okay. But you'll know it from our pictures. Now, let's go out the brachiocephalic again, pass the external jugular, and then there's a small section called the subclavian, going underneath the clavicle, subclavian. And when it splits, the split is to the subscapular, shown over here. This goes under the shoulder blade to the subscapular muscle. This goes over the shoulder blade to the muscles on the posterior side of the scapula, the transverse scapular, subscapular. Once you pass the subscapular, everything else, it's fair game to call it brachial. These vertebrals that I said I would come back to, I am coming back to them because this drawing has been around for 15 years. I keep changing it. Somebody keeps changing it back. I don't know who has the ability to do that. But these vertebral veins, they enter underneath, not on top, underneath the superior vena cava, and they come from the vertebrae. If I saw it either way, I would give you credit for it, but I'm going to be able to show it to you very soon. You know, people worry that, oh, we don't have a real cat. I can't get a feel for it. And I listen to this, I think to myself, yeah, that's what the last person said. And then they do great. Then they do great. It's not as difficult as you think. And as far as how does this translate to human beings, we have every one of these vessels in approximately these places. We just don't have these ears. Okay, so now underneath here, you'll see I have bolded like external jugular vein, transverse scapular vein, brachial vein. Those are the ones you need to know. Okay, and I've given descriptions for you for every one of them. Then I inserted a blank sheet that if you download this or print it out, you can use it as a self-test. The arteries above the diaphragm, okay, these would normally stain or have a latex injection that is pink, sometimes even red, but usually pink. The diaphragm's down there at the cursor. Arteries go away from the heart, so that's good. First, this artery here arches over. This is the aortic arch. You don't see a little opening down here underneath the aortic arch in this presentation, but it doesn't matter. You usually don't. This is the aortic arch, sort of like a finger that is bent, folded, and comes down to here. This is the descending thoracic aorta. Once it passes the diaphragm, it's out of our territory for today, but we will call it the abdominal aorta. So these just changed their name, not their function, not their direction, or their destination. Descending thoracic aorta. To see this, you have to take the heart of the cat and take it from the left side, pull it to the right side, look underneath it, and it's so big. Now, coming off of the aortic arch, there are two main vessels, the brachiocephalic and the left subclavian. Okay. There is only one brachiocephalic. We saw two brachiocephalic veins. The brachiocephalic comes up, and then it splits here and here. And these two vessels are the common carotids on either side. Common carotid. The common carotid goes laterally behind the ear, with the maxillary. This is the facial. This is actually the lingual, but we're not going to do the lingual artery. We'll do the facial. There is no connector from right to left in cats or humans. Okay? So we don't have a transverse carotid. We have a transverse jugular. Come back down here. We got to the top of the brachiocephalic. The first change it makes is to arch or break into the two common carotids. After that, The small bit of vessel is called the subclavian. I want to get this upper one off of here. See where the pointer is right now? And the pointer is right now. They are vertebrals. There are vertebral arteries. They come from the vertebrae. They come up and they join roughly here. But they're so rare that we see them. They just confuse the situation, I think. Instead, I want you to focus on this little guy coming back towards the heart. These will usually stick up straight like a piece of straw. They often look like a pigtail twirling around, okay, when you find them. And they're always the same thing. They're the mammary arteries coming from the right and the left chest. Back up to the little subclavian, which is this. Remember, we're going to take this one out. I'll take it out. And the next structure coming off is the transverse scapular. Here's the transverse scapular over here. After you pass the transverse scapular, you have the axillary. The axillary. The axillary means at the armpit. And this is exactly where this vessel is, right at the armpit. Okay. Also, when you're cutting through it, you would hear the cracking of ribs because that's where they are too. Axillary, and then the next one is the subscapular. Same names, subscapular. After the subscapular is always the brachial. This gets followed by some text that I put together and bolded the important ones that you have to know. A diagram to test yourself on. No one cat or human, for that matter, has every vessel. We try to find every vessel using several specimens. Here's the heart, and above it, using veins here. Here's the vena cava. It's not labeled, but this is the mammary. Okay. You can see the vena cava now splitting. 1, 2. You may have to look closely to see that. But these two vessels are the brachiocephalic. Here, we go up the side. This is the external jugular. And this one is the transverse scapular. Here's the internal jugular. A really nice one. A really nice one. The subscapular doesn't show on this picture. It's underneath this area here, but we'll see it in just a second. Okay. Heart again. This is brachiocephalic. That's brachiocephalic. This is the external jugular, maxillary, the linguofacial, the transverse jugular. Coming back here, this is the subclavian. This is the subscapular. And after the subscapular, we have the brachial. This is the subscapular again. Here's the transverse scapular. Looking at this, all we have is a labeled diagram of what we just said. I don't see any, well, yeah, they have a vertebral labeled. It's right here. This vertebral goes underneath the brachiocephalic. Typical places to find a vertebral are underneath the brachiocephalic or underneath the superior vena cava. And you don't see them at first often. This one you do. So you actually take your tweezers or your thumb and finger and lift this vessel up. And you see it's held down by another vessel. That would be the vertebral. Okay. Facial, maxillary, transverse jugular. And it should have been labeled. This one here is the external jugular. The heart is down here on the right. And you're bringing up the brachiocephalic, subclavian, come back. We start upwards here. This is the external jugular. It's confusing at first because the external jugular, then what the hell is this? This big thing is the internal jugular. Usually we don't find it this large. But from where it's coming off and going, it can't be anything else. This is the carotid. Here's the subscapular artery and vein with it. And after that, we have the brachial artery. These are the same. There's nothing new here, and it's not as good a picture. Okay, this is often a nightmare for an instructor to come over to a cat and see it looks like this. But you got to help the student as best you can. And most of the poor presentation is really due to the cat itself, not to the student. Okay. So what do we got? Heart is here, superior vena cava, a brachiocephalic vein coming there and here. Here's the subclavian vein. Here's the subscapular right here. Now see where it goes right here? Subclavian vein ends when the subscapular begins. And this is very short. Well, that's just individual variability. Subclavian, subscapular, beautiful one actually. And then after you pass the subscapular, the rest is going to be brachial. Here's the external jugular, and it's bent here. And here's the transverse scapular vein coming off of it. Okay, now we've got to the halfway point. Sorry about the date. I need to get that changed. I'm going to quit putting dates on things, except on the module itself. Same information, nothing's changed in the vessels of the cat in the last year. So here are the veins that are below the diaphragm. The diaphragm is right here. We expect the inferior vena cava to be down here. And I want to go from there all the way down to here to make it easy. The inferior vena cava receives blood, because it is a vein, from the suprarenal glands, which would be located right here, and the kidney. And that's from the renal vein. Renal vein. Renal vein, suprarenal vein, IVC, inferior vena cava. On the left-hand side of the cat and human, we have the left gonadal. This usually comes from the ovary and not the testes on the left side. This is the left gonadal, though we don't have to identify the sex of the cat or the specimen. We can call it left gonadal. On the other side is another renal. Everything's nice. And then come down. Here's the right gonadal, coming from the ovary or from the testes. Occasionally, it's true, the left gonadal is here 90% of the time, but 10% of the time it's here in a mirror image. We won't pull any tricks on you. Come down farther and look at the body wall behind the organs, behind the intestines. And there's an array of beautiful red and blue vessels going right and left. These are the iliolumbar. Keep going straight, and you find the mid-sacral, also known as the middle sacral, quite a few other things, but mid-sacral is the going to the tail. Okay. Do humans have a mid-sacral? Yes, we do. Okay. Do humans have tails? Once in a while, somebody is born with a tail, and you can bet the doctor will snip that thing off before there's a lawsuit. Okay, here's the mid-sacral. Now we're going to go out towards the left in this case and right over here. Okay. Come around and find the deep femoral. Deep femoral. I want you to imagine that you have a cake mixing bowl. Okay, a mixing bowl. Okay, and set it in here. And up at the very top edge, you have this structure here. This is the this goes along as the femoral down here. Once it gets past that mixing bowl, this part coming in across the top is the deep femoral. Once the vena cava comes down here, it splits. And each part is called the common iliac. Common means that two things are going to come together and they're going to use the same name. The two things that will come together here are the internal iliac here and the external iliac. Now, the mid-sacral, remember the bowl, remember the mixing bowl. If you have cake batter and it drips down the side of the bowl, goes down, that's the mid-sacral, it goes down to the bottom of the bowl, running down the side. Here, the internal iliac runs down the bowl. The internal iliac runs down the bowl. Okay, once you pass the internal iliac, you have the external iliac. It's up on the top of the bowl again. And the deep femoral comes around and it's on top of the bowl. Now there's a space left here because the two deep femorals usually do not touch each other. I have seen it where they do, but it's rare. The internal iliac, we know that the iliac bone is down in the pelvis there. It's going down towards it. The external is bypassing. Once you pass the deep femoral, you have the femoral. And keep on going. And out to the knee, you have the popliteal. The popliteal. Extending downward all the way to the ankle is the great saphenous vein. The great saphenous vein. We'll see these in the pictures in a second. Here's the text and the bold material that you need to be able to recall. Here's a practice diagram. Arteries below the diaphragm now. I put the text that looks like up front. Okay, so here are just arteries. Here's the diaphragm. This major vessel here is the abdominal aorta. It's actually the descending thoracic aorta if it's up here above the diaphragm. But since we're supposed to be doing the ones below, this is the abdominal aorta. Skip this one for a moment. Skip this one for a moment. Come down and find the kidney and suprarenal gland. Suprarenal artery, suprarenal artery. Renal and renal. Come down farther. Opposite each other are the gonadals, just like they were in the veins, except in the vein, this left gonadal is usually attached to the renal on the left side. Come down to this point, and we have the iliolumbars that I said look like red and blue brooms, actually. They're beautiful. Okay, we'll save the bottom part for last and go back up and see what we missed here. This first vessel above the iliolumbar will be on top of the abdominal aorta. And if it's not detached or broken, it will make its way to the colon. This is the inferior mesenteric. The inferior mesenteric always sends blood to the large intestine. Did this one, did this one, did this one. The superior mesenteric sends blood to the small intestine. They call it mesenteric because it actually enters into the mesenteries. That's the serous membranes that we talked about in the small intestine anyway. Superior mesenteric goes there, sends the blood there, and it goes from there into the small intestine. Now, that leaves us with this strange one here. Underneath the diaphragm, the first vessel off of the abdominal aorta is this one that splits it really quickly and goes to 3 organs. One goes to the liver and is called the hepatic artery. One goes to the spleen and is called the splenic artery. And the one that goes to the stomach is called the gastric artery. All 3 of these come together at this point here, the celiac artery, sometimes referred to as the celiac trunk. We very seldom in any specimen see the hepatic. Okay. Doesn't seem to preserve, but the splenic is very obvious, and the gastric is easy to find too. Okay. Down a little bit lower. Well, we get the same splitting in 2. Okay. So we can just start at the end. This is the popliteal. Rather than great saphenous, we call this the saphenous artery. I don't know why. Come back up, and we don't have a common iliac artery. We have an external iliac artery here, a little tiny piece of aorta left here, and then the internal iliac artery, and then coming off of the aorta at the very end is the midsacral. It's a different arrangement, but everything goes to the same place or comes from the same place. The external iliac artery continues till we get to the deep femoral. After the deep femoral, we come to the femoral. We keep on going on the femoral until it splits to the popliteal and the saphenous. A practice diagram. Okay. We call these flat man models. It could be a flat woman, but we've always thought of them as men for some reason, but they'd be the same. I don't like them. I don't like to teach from them, but it's part of the course, part of the curriculum that you learn it. That means it's part of the curriculum that I have to present it. Okay. So let's see what we can get out of this one. Okay, brachiocephalic artery. Here's the heart in red. Here's the arch. And the first vessel off is the brachiocephalic. So that wasn't terribly hard. Here's the common carotid artery. The second one is the common carotid. The third one, say 1, 2, 3 off the arch. Third one is here, and it's the left subclavian, or just subclavian. You need to then come down, we're just doing arteries for a second, come down to the shoulder girdle, at least this far. And this is the axillary artery. Down farther in the arm is the brachial artery. The inferior vena cava, below the diaphragm, is coming up. Here's the superior vena cava, here. Inferior vena cava, here. This is the axillary artery and vein on the right side, and it was pointed out on the left side already. Subclavian artery and vein here, Well, here was the subclavian artery. Okay, that one wasn't too bad. This one tries to show you the hepatic artery, and I told you you can't do it really on a specimen, but you can do it on a model. It's here going to the liver. The inferior vena cava. This is the splenic artery. It's coming all the way across. When we dissect, we tend to take the spleen, push it to the other side, and then we get surprised that it comes over this way. Well, it does. Here's the splenic artery. The abdominal aorta in red. The superior mesenteric is shown here as a cut vessel. That superior mesenteric, remember, it goes to the small intestines. Inferior mesenteric is down here. No, I wouldn't dare ask that. The shine in there just ruins everything. Renal artery and vein. Vein on top, artery down here. Here's the common iliac artery. Common iliac artery. In humans, we have a common iliac artery. In cats, we do not. That's one major difference between the two. In cats, there's a common iliac vein, but there's no common iliac artery in cats. Now, don't worry that you're going to have to write that down and get it. I will drill it into your head a few times before I ever ask you a question on that. Okay, here's the common iliac. Here's the internal iliac. Here's the external iliac. Here's the deep femoral going across. After you pass the deep femoral, over here you have the femoral. That's the artery. This is the vein. Femoral artery again until it splits, becoming popliteal and saphenous artery. The greater saphenous vein is here, and it runs in front. It runs medial to the kneecap. The kneecap is not showing. It's not here. It is showing over here. So if you're standing forward and you have typical lateral and medial, on the medial side of the knee is where the great or greater saphenous vein is located. Okay, none of that is for Thursday, obviously. And does anybody have any questions about what is for Thursday? If you think of them later, because you can't think of them right now, well, just email me. Okay, and also take a look at that email that I posted. You need to do your best. Of course, I would say that to any class. You need to do your best because there's no extra credit from here on out. The only extra credit, but that would be an exception to that, is the 5 points of extra credit you get for P3 and the 5 points that you know you get for P4. Okay. I've, you know, I like to have an enjoyable class as much as possible, but once in a while I have to say something. So I think I'll say it now and then go on and have an enjoyable class. I often get, when it comes to be time for grades, people who are shy by or short, like 10 points or something, and they ask me for 10 points free and give them a high grade. I'm not going to do it. I don't ever do that. Okay, I get some people that will persist and persist and ask, and it's just heartbreaking. I hate that. The time to get those points is on these last 4 tests. Get them on those tests, and both of us will be much, much happier. Okay. But okay. Okay, I'm going to hang around here for a bit while any of you have any questions. But otherwise, we'll see you on Thursday at 2 o'clock. And, you know, you can go ahead and leave at any point that you want.
Have a good rest of your day, Charlie.
Thank you.
Bye. Thank you, Charlie.
Thank you.
Thank you, Charlie.
Bye-bye.
Thank you, Charlie.
Take it easy, Christopher.